We feel that people who have had COVID should not be excluded from vaccination. We do not know how long the natural infection protects anybody. We now have data up to 8 months from a paper published yesterday, but we do not feel that this is enough to exclude the people from vaccination.
It's absolutely not necessary to get tested in any way before getting vaccinated to figure out whether you've had or haven't had COVID. We don't recommend any sort of testing in that way. But if you happen to know that that you actually have had COVID, we're still recommending that you go ahead and get vaccinated. But it's just getting started with the vaccine, and every country is trying to deploy that vaccine to the very highest priority groups. There is much less likelihood of somebody who's actually had COVID disease, at least in the next 6 months, to get it again. So an individual might just decide, that they'd prefer for, the person that they work with to be first in line ahead of them. But we're not suggesting that programs actually exclude or delay the vaccination of people who have had COVID disease.